If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Rockingham County 411, you're in a good place. Today we are talking with our interim public health director, Susan Young. We appreciate her being with us today, and she's going to be telling us how we can stay safe during the holidays. So you want to give us some idea about private social gatherings? What should we do? What should we be cautious of doing?
Yes, Mabel. So there is some interim guidance that has come out from the Department of Health and Human Services. So I just wanted to go over some of those things that they have highlighted in there. Of course, you know, it's better not to host any large gatherings and keep them within the current mass gathering limits, which could potentially change, you know, before the holidays, before Thanksgiving and Christmas. But right now it's 25 people indoors and 50 people outdoors. And, you know, those, I don't know if anybody's house that I know of that could hold 25 people 6 feet apart safely unless you did do it outside. So just remember that. You still want to use that social distance even if you are having people inside your home to be sure. So just remember that.
So maybe stay on the patio or stay in the backyard? Or
Yes, that would be the best thing to do, is to be outdoors where
on the deck.
Air is circulating, and hopefully our kind of Indian summer will hold out and we'll have some days in the 60s and 70s near the holiday. Sometimes it seems like near Thanksgiving the weather is warmer, so hopefully that will work in our favor. And be sure that you talk to your people right before the day of your gathering. Make sure no one has any symptoms. They are not feeling sick. They haven't had someone in their family or a close relative that has currently, you know, in the last 48 hours gotten a test where they are positive or they're being tested. Just be sure to kind of check up on your guest to be sure how they're feeling and how they're doing.
And as far as the actual event, we should, of course, social distance, wear our face masks. We should still do that, right?
Yes, even if you're inside with your family, please try to wear a face mask. That does prevent the spread of germs inside your home. I know a lot of us now have the HEPA filters that are inside our homes. I have a machine that cleans my air. It has a UV filter. Those are great if you're going to have gatherings. Just put that over in the corner, let it be running, let it be cleaning your air. That is helpful. Wash your hands often, and of course make sure everybody washes their hands prior to eating. That is something that you really need to consider, is that good hand hygiene. Using the hand sanitizer, have it at the front where if people are going through like a buffet line, squirt a hand sanitizer as they go through. That will be sure that everyone's hands are clean right before they get to the food. And also limit the number of people who are handling that food. If you could just get like one person to bring food or one person to make the food, it's better than having like 10 people from their homes bringing
What we
dishes
normally
in.
do.
What we normally do.
You bring the potato salad.
Right.
I'll bring, yes.
And I think about that with church gatherings, because our
do it all
church
the
used to
time.
have a huge gathering where we
Yes.
all bought dishes, and I was thinking that is not a good time during COVID to be doing any of those types of things.
So during COVID, let's have one person to prepare all the food and to serve the food.
Yes, and you know how you go through the buffet line, if you could just limit, like you could have one person go through, go out the other door, have another person come through, and not having people congregating over the food. I know we have a tendency to do that. We congregate over the food.
I wonder why.
Yes, because it's usually so good, but people
Yes.
do congregate over food, so let's try to limit that. And limit the number of touched items, like you have a spoon and everybody coming through is touching that spoon. If you could just try to limit that, that's going to be tricky to do that, but if you could do that and have somebody maybe clean between, you have so many people go through and then switch out the spoon, get a clean spoon or clean it, or just wipe off the handles so you're not, everybody's not touching it over and over. And I have a great thing at my house. I have, and my grandson loves this, it's a garbage can. You step on it and the lid flies open by itself and you put stuff in. He's 2.5 and he loves to put stuff in the garbage can all the time because he likes to step on it and it flies open.
Of course.
But that is a good thing to use where everyone is not touching the garbage pail also.
Yes. Wow, that's a lot to think about.
Yes, and using reusable items such as tablecloths, things you can throw away, linen napkins, paper napkins, just use those and throw them away. I know we like at Thanksgiving to get out our
To bring out
fine
the real,
china
yes.
and the fine linen napkins
Yes.
and to use those. But if you do, be sure you wash them in hot water afterwards to kill all those germs.
Let's just be informal and save time and
Those
effort.
paper plates,
Yes.
Chinette has some that look really good, you guys. So you could get those Chinette plates out that looked really nice and use those and just throw them away, and that would save you having to wash dishes also. So just think about these things like this. Like I said, use that social distancing, limiting physical contact, wear your cloth face coverings during these events, and just try everyone to be safe. And just consider high-risk individuals also. Just consider the age group of the people that you're going to have there. If you have 65 and older people there, please take some special precautions for those folks. They are more vulnerable. If you can, take some special precautions for them.
And I love this theme that the North Carolina Department of Health and Human Services put together. Staying apart brings us together, protecting our family and neighbors.
Right.
And that's what we want to do, protect everybody.
And we know the holidays are going to look very different this year. There's going to be a lot smaller gatherings. Do virtual, do FaceTime, do those Zoom, do put up computers where you feel like people can be there and can be seeing what's going on, even if they're not in the room with you. They can be part of the celebration.
That would be fun.
And we can have high hopes that next year things will be very different and we can get back to somewhat normal. But this year it's just going to have to be a little different for us all, Mabel.
So we can just take time to make a list of what you've given us. We can use this for Thanksgiving. We can use this for Christmas,
Yes.
New Year's, all the holidays, so we can protect our family and friends.
Yes, and I, like I said in the beginning, this guidance is on the Department of Health and Human Services COVID website. It is good guidance. They're trying to get ahead of the holidays so everyone can plan appropriately.
Okay,
So-
and we will have this on our website also. It's already out there at www.myrockinghamcountync.com. That's www.myrockinghamcountync.com. And we label it, it's from the North Carolina Department of Health and Human Services, but it's labeled as Interim Guidance for Private Social Gatherings. Interim Guidance for Private Social Gatherings. And speaking of holidays, we just had Halloween, Costume Day, lots of candy, cookies, potato chips. Did you see a rise over the weekend or so?
We have not seen a rise. We actually had a lot of cases this past weekend. We had 134 cases added to our listserv over the weekend. So that was a big jump.
Yeah.
And that was prior to the holidays, so the Halloween holidays. So we
Yeah.
will look and see what we will be getting. Our cases are up. Rockingham County's cases are up. We are kind of, when I looked on Monday, we ranked number 11 out of all the counties in our percent positive tests for the day. And let me explain that a little bit.
And you mean out of 100 counties?
Yes. Well, it's 80 some technically because there are some that are together, like Martin, Tyrell, Washington. There are
Okay.
some combined counties, but
Okay.
as far as health departments go. But I'll kind of want to explain our percentage. We are at 9.6%. And what that is a percent positive test for the day. They do not update that each and every day, but it's like how many tests you have in your county within that day. Let's say we do, I'm just throwing out a number, 5,000 tests. And if 250 of those tests are positive, that gives you your percentage rate of the
I got
day.
you.
And that's kind of what they're using as statistical data to say how much COVID is in our community at this time period. It's not exactly case counts, it's not exactly the numbers positive against our population. It's just a statistical way to show how much COVID is in our community.
But that particular number, when you look at that in correlation with other counties, and how do we stand? What's a good number?
A good number is 5 and less. That is what.
And we did have a good number. We did have a 5.
In the beginning, we had good numbers. After our long-term care facility outbreak, our numbers rose, and we were struggling to get that number down.
Yeah.
I think one day last week we were down at 6.9, but like I said, we're back up to 9.6. So those numbers fluctuate. The state is kind of at 6 right now, and we really want those numbers to be down. Well, you can also help with that if you go and be tested, and we do have a testing site that is operating here on our campus on Monday, Wednesday, and Friday from 8 to 5, and they do lunch break from 12 to 12:30, and that information to do that, they will take just walk-ups, drive-ups, so if you need to be tested, you technically don't have to have an appointment. You will get through quicker if you do. If you go on the website, that information is also on our website. If you go to the Optum website, they will give you a number. You go through the drive-through, it is completely drive-through. If you drive through, give them that number. You're out of there in about 10 minutes. It's very quick.
And this is free too?
That is free. It is completely free.
Good, good. What about the flu test? Have we finished with that now?
We have kind of stopped our drive-through flu clinic for this year. It is kind of over, but you can still call the health department and make an appointment to get a flu shot, and we will be glad to do that for you because it is still very important to get those flu shots. But our drive-through is over as of the end of October. So, but just call. We can get you in, make an appointment. There are still physicians' offices that are giving flu. There are some Walgreens, Walmarts, and places like that are still giving some flu. So just check around to see where you can get a flu shot if you still need one.
On Monday night, you did a very good presentation to the Rockingham County Board of County Commissioners. You want to just give us a short little snippet of what you shared with our commissioners?
I shared with commissioners that where our case counts were, and we had a good informatic kind of slideshow presentation that showed the cases feed in since this began in April, May, June, July, August, September, and October. And it puts dots on each of the addresses of those people that are unidentifiable. I just want to make sure everybody understands that. But you can see that information and see how those dots kind of line up with our cases. And we are having, Reusable has our highest area of cases right now, followed by Eden and then Madison, Mayodan.
And you also mentioned Summerfield.
Yes, Summerfield has had kind of a spike in cases here recently also.
Okay.
Yes.
So, what do? Our homework.
Keep wearing your mask. Keep staying at home as much as possible. Don't go out unless you need to. Limit those interactions within your immediate family group within your home, because we are seeing that is our #1 spreader at this time is family gatherings. And that can be with extended family, cousins, aunts, uncles. We are seeing that go up. And then our other high spreader is from unknown sources, community spread.
And one other thing, you mentioned that there was additional help for you and your department through the State Department with the contact tracing.
Yes, we are actually assigning some of the contact tracing to those people at the state level, and they have people hired, and what they do is we assign it and then they call. So if you see a strange number come up on your phone, or you get a voicemail from people who say they are CCTO or said they're working on behalf of the Rockingham County Health Department, please answer that call, and we will see if we can get that information of your close contacts and get those people isolated and quarantined.
Okay. Anything else you'd like to share?
No, I know there's been a lot of talk about antigen testing, so I just wanted to explain a little bit about that. That is also...
What does that mean?
That means it's the rapid testing that occurs within 15 minutes, and that can be done, but the state is not exactly accepting those results now. If you have a negative, it's presumed negative, But then you also have to confirm it with a PCR test, which is the initials are hard, the reaction test, but it is a better test.
Okay.
It tells a better story. So we do have to have those antigen tests that are rapid, kind of proven positive or negative with a follow-up PCR test.
So we're going to have to add the PCR to our alphabets,
Yes,
our COVID
yes.
alphabets. Boy, it just keeps expanding and expanding.
Yes, it does.
We
And
can't wait for a cure.
the vaccine is coming. It's coming. It looks more like now that it will be towards January before we will get it. But we are starting to train and starting to get information funneling through the state. We have signed our vaccine provider agreement here at the health department. It will be funneling through the health department. So we are getting our quote-unquote ducks in a row to be able to distribute that vaccine because it is coming.
So as soon as it gets here, then you will give us additional information about what we can all do.
Absolutely, and how that vaccine will be distributed.
And who will receive it.
Yes.
Thank you so much. You've heard it all from Susan Young, our Rockingham County Interim Public Health Director. Thank you so much, Susan.
Thank you, Mabel.
We're going to wear our masks and wash our hands and stay 6 feet apart.
That's right.
And do all the things you suggested for the holidays.
All right. Thank you.
Thank you. Rockingham County 411, you're in a good place.